Mechanical restraint using ties, sandbags, and a trough are all used throughout this video, and you will see them as we're taking x-rays. A radiation monitoring device, or dosimeters, register and maintain a charge over time if exposed to radiation. They should be worn on a thyroid shield at your location anytime you're exposed to radiation, whether you're taking x-rays or fluoroscopy or you are working on any x-ray machines. As well as the MPD, or the maximum permissible dose, is 5,000 millirems per year, or 5 rems per year. And that is monitored by the radiation badges are sent in every 6 months or a year, and they are read and maintained, those records, to make sure that you are staying within those standards. Right, we keep our dosimetry reports right here on the wall. So I will take one of these and we will evaluate it. So I will use my own right here, Castillo Jenny. So this is our standard calculation. It is a dosimeter type 82. The location is right here for Chastain. It is, but for the dates between 10/14/16 and 11/30/2016. And it looks like body doses are 15 deep, 15 I, so our current dosing, and 14 shallow. And just for this year, it was 15, 15, and 14. And for my lifetime, it is 15, 15, and 14, since this was the first year I was taking x-rays. Alright, when we are inspecting our PE, we are going to come look at our aprons here. Make sure there's no cracks, wear and tear on either side. They always want to be hung up this way so that they don't get any cracks on the lead on the outside. Make sure everything looks good there on both our aprons.
Did I leave my chart in here?
Thyroid glands, thyroid shields. Here. Make sure there's no visible wear and tear. And our lead gloves. No wear and tear here. I'm putting on our personal protective equipment. I'm going to get my dosimeter badge. That's going to go on the back of my clothes on the outside of the apron to measure how much radiation is going through me. I'm going to take my aprons that we're hanging up, place this one around myself, and bring the straps around and tie it in the front. Going to take a thyroid shield, place that around my neck, it velcros in the back. Make sure my dosimeter band is out here. And gloves will go on this way. Fingers can come out the outside, or if you're doing something where they may possibly be exposed, it can go in all the way. This. And if we had goggles, we would put them on. We don't have any goggles here though. Protective barriers include walls, ceilings, floors, doorways that are made of lead or similar. They're compared to lead when they're made. And all of the barriers in an x-ray room should be radiographic barriers legally, as well as there are movable barriers made of lead that can be used as well. No portion of any human, either shielded or unshielded, should be exposed to the primary x-ray beam to help limit the amount of radiation to your body, especially if you're directly in the primary X-ray beam is where the most radiation is emitted. The good restraint methods to be used that help distance you can be used sedation, chemical restraint, and then sandbags and ties to help you get farther away. There are barriers and shields that help with that as well. Non-essential personnel should be removed during the X-ray suite to help limit exposure to as many people as possible. You want the least amount of radiation exposed to the least amount of people. Diagnostic radiographs, you should try to get on the first exposure to help limit X-ray exposure and the radiographic exposure to both the personnel that are helping with it and that are in the room, as well as the animal itself. Pregnant women and people under the age of 18 should be limited to radiation because embryos and fetus and individuals under 18 are more at a greater risk of radiation injury due to their rapidly reproducing cells. Since they're still growing, it can cause a lot more issues. Alright, we are going to take a lateral medial view of our tibia and fibula on the tip here. We're going to take it on his right side. Put the right marker in our field of view. See if I can place the sandbag. He's not really cooperating with our sandbag. Let me try a tie down here. That came undone. Oh, you're okay. Alright, so for this view, we are going to we measured the midshaft of the tibia and fibula. We'll place the central ray in the same spot, and our borders are going to be the tarsus and the stifle. Right. So we collimate this down a bit. Alright, today we're doing a craniocaudal radius ulna on Maverick here. He is a little nervous and not letting us use any sandbags or tape, so we're going to be holding his head out of the way and making sure we use our lead gloves. We have all of our apron, our thyroid shield, and our radiation badges on. We measured at the site of the distal humerus and got 6. We set our X-ray machine appropriately. The central ray is going to be down the midshaft of the radius and ulna, and the borders we're going to put proximal to the elbow joint and distal to the carpal joint. Here. Let me see. I can grab his face. Okay. So I'll make this down. Right there. Nope. A little sideways. For Maverick, we were radiographing his left leg, so we chose the left marker that we placed right next to his leg there in the X-ray. Alright, so this is Blue. We are doing a lateral abdomen x-ray of him today. We measured at the caudal aspect of the 13th rib and got about 20. We set our x-ray machine accordingly. We have a cassette in and a right marker, a little lead marker that's an R placed just caudal to our abdomen here. We'll lay him on his side. You can use sandbags if you don't have another person or to help get out of the x-ray beam, but we use people just in case anything were to happen and they freak out. But we have our lead gloves, our thyroid shields, our lead aprons, and our x-ray badges on our backs here. So we're going to collimate our beam. We're going to want the central beam on the caudal aspect of the 13th rib at about the level of L2 or L3, and our borders are going to be cranial from the caudal aspect of T7 and caudal to the greater trochanter to include the coxofemoral joint. Alright, and we can go ahead and take it. Alright, for our VD thorax, I'm going to want the central ray midline to the caudal margin of the scapula, or between this 5th and 6th ribs, and our borders are going to be the cranial point of our scapula-humeral articulation to the first lumbar vertebrae. And since we're not very happy, it's hard to use any of our sandbags or position our central beam here. Alright, perfect. And let me put my right marker in here. And you can take the x-ray. Alright, I'm going to show caliper use on this kitten here that we're going to take a VD thorax view of. And I'm going to measure at the caudal border of the scapula. We've got about 6. And so I'm going to look at my sheet over here on the wall for thorax under grid tray. It'll be 76 and 10. So I'm going to come back over here and set my settings here. Right now it's on 79 and 7.5. So I'm going to go down 77 is about as close as we're going to get. Turn up my MAs to 10. And then we only have one size of cassette here. And we don't have any small cassettes. We only have this size. I'll make sure that there is a cassette loaded. And we're ready to take our x-ray. For taking dental radiographs, we're going to take our upper and lower incisors. I'm going to start with the upper incisors. We've got our x-ray machine here. It's got a little plate that we put in. We're going to start by placing it right over the upper incisors and keeping it packed with water. A little bit of pause so it will stay. I'm going to place the machine upright, perpendicular to that plate. I'm going to take my little remote that is set to upper incisors and small dog, and I'm going to step out of the picture and take these. now that it is taken, we've got our machine set here. And this is our first picture. Alright, for the lower incisors, I'm going to take this plate again and reposition it on the bottom. Just a little more to get that to stay right where I want it. Or being perpendicular right over those incisors. Once again, I'm going to set this to our lower incisors. It's still set to small dog, and I'm going to step out around the corner and press expose. Now it is loading our image. Alright. And here's our second image. It's a little over. We have these 3 teeth that were crowded in. We're missing one. These are the 3 we were trying to get mainly. Now I'm going to show you how to enter patient information into the software system to create a file for the x-rays. So they should have information in our system. If they are one of our clients, we'll type in the animal's name and last name. Here.
I'm not gonna...
And then... Alright, so here is our patient. This is going to be the kitten. And these are everything we've done. So I'm going to right click in here. We're going to go down to imaging and over to image capture. That's going to bring up our IDEX PACS system. And now it's going to ask me where. I have to put my veterinarian in, which is Dr. Mari Childs, and my name for the technician here, and then I click on which x-rays we're going to be taking. So if I'm taking our VD thorax, I would click the thorax here, and thorax VD. I would press done. We would take the image, press capture here, and insert the cassette down into our machine that reads it and brings it up on the screen. Retrieve files, you have 2 different options. You can come to our actual IDEX PACS system here. Right now it's showing all x-rays taken in the last 2 days. So I can just click on, say this is Heidi, and these are some of the x-rays from Heidi. As you can see, that we took our right rear extremity pictures, and I can see both views here. I can also go out of our IDEX PACS system and exit there and go search for patients. I'm going to open one of my dog's Sloan's and go look for her x-ray pictures she got here, and I can double click those and it'll bring up our IDEX PAC system and straight to those x-rays from the file. So here are some of her previous x-rays. Alright, for finding our logbook or how to correctly enter information for the radiographic study, you're going to go to the chart that we're looking at, as I brought it up here. We're going to go to the exam from that day that we took the x-rays, and if you look through the note and scroll through, under our diagnostics and tests should be radiographs and the results of those that the doctor will input, as well as any treatments that they recommend for that. For retrieving our alternative images such as ultrasound, we're going to go to our client again. This is our clinic cat Romir. He got an ultrasound done about a month ago. So I will go into his file. We'll go down to this DCM image here. It'll bring up our IDEX PAC system, and it'll bring up all of our ultrasound pictures that he has taken. So there's a list of them here that we can scroll through and look at our different ultrasound pictures that were taken. Alright, this is Ranger. He's our patient today. We're going to be doing a barium GI studies on, and we've already calibrated it using the caliper and set our KVP and our MAs correctly. And first we're going to take our before series of pictures before we feed him the barium and take our GI series.
Ranger, baby, you're gonna have to calm down, okay?
Now we took our lateral, and now we'll take a DV as in before. So we've mixed about 50 mils of barium in with some canned food, and we'll let him eat that and take our next set of pictures.
I know. It's okay, Ranger. Come on, you're gonna. We can't have you throwing up. Ready? Right, shoot. Good boy. Okay. slide that plate out. It's over there.
Stick it in arrow to arrow.
Yeah, and then hit capture. Ready? I know, honey. It's okay. Good boy. Good boy. Good boy. Good boy.
And we'll take another set of x-rays in 5 minutes. These are our post 5 minutes after barium radiographs. We'll do our lateral and our DV again. The reason we're doing DVs instead of VD is due to he has a problem with vomiting up food, and we don't want him to aspirate the barium since we are looking for mega esophagus or another problem.
It's all right, Ranger. It's okay. Come on. It's all right.
It's all right, buddy. It's all right. Alright, so measuring, you're going to want to measure the widest part of the hips right here. And it is 16. We'll match it up on our grid over here to see what it is, and it'll be 84, 15, 300, and set this. Our gloves on. We're going to want to position them on their back. We've got the right marker in. We're going to want to make sure they're completely straight. Head straight. Make sure that their legs are together and flexed. And we'll take the picture.